Good morning. Today I will provide you with some information regarding the transdermal nitroglycerin patch. The transdermal nitroglycerin patch is used to prevent instances of chest pain, also known as angina. This occurs to those who have coronary artery disease. Coronary artery disease is an area in the blood vessels that supply blood to the heart. The chest pain is caused by insufficient blood flow and oxygen to the heart tissue. The transdermal nitroglycerin patch works by relaxing the vascular smooth muscle in the body, which will lead to a decreased venous return to the heart. This is referred to as a less preload, and a decrease in blood pressure, which is a less afterload. You may be asking yourself, what is this nonsense about preload and afterload? Essentially, this medication treatment makes it easier for your heart to beat. Since less effort is being used by your heart, the pain will be relieved, and less oxygen will be required for your heart to work. However, while this medication is very effective, some adverse effects to look out for include flushing of the skin, dizziness, headache, and fainting. If you experience any of these, please make sure to contact your primary healthcare provider. Now I will give you specific directions on how to use the patch at home. It is very important to follow these steps. When placing the patch, it is important to apply the adhesive portion on the skin of the torsion. The nitroglycerin patch is slowly absorbed through the skin and into the bloodstream. It will take about 30 minutes for the drug to take effect. The effect will continue for the next 24 hours. The patch must be removed nightly. You should have a 10 to 12 hour drug-free period. This means that the patch should be removed at night and then reapplied the next morning. If you remove the patch at 9 p.m. before going to sleep, reapply the following morning at 9 a.m. This demonstrates a 12-hour drug-free period. If you do not remove the patch to allow for a 12-hour drug-free period, you risk developing drug tolerance, which could reduce the effect of the drug. If you feel faint at any time, it is important to lie down to prevent any incidents of falling. It is also important to avoid any activities that can cause angina, such as overexertion, emotional upset, and overeating. While taking the transdermal nitroglycerin patch, it is imperative to be aware of the interactions it can have with other drugs. You must avoid taking any drugs that are used for erectile dysfunction, such as sildenafil, tadalafil, or donafil, also known as Viagra, Cialis, and Levitra. Taking any of these drugs would magnify the effects of nitroglycerin, which could cause you to have very low blood pressure and even get a heart attack. It is very important to not take these drugs even at night while having that 12-hour drug-free period. Now we have reached the end of the instructions. Please let me know if you have any questions.